Like,
The
come
Dave
on, let's
Chappelle,
go.
yeah, let's
Yeah.
wrap this up.
Let's go.
And actually, that makes total sense.
Yeah.
Because I know me.
So that's our life mission. That's the McShinn's mission.
You don't have to understand my boundaries to respect them.
Well, no, I'm the president, co-founder of McShinn, a person in long-term recovery from substance use disorders.
How do you go about fixing the damage in the trust between the family after you get out?
Okay, I gotta work on that.
Celebrating my 6 months. Didn't have cake.
Yeah.
Gosh, you're scary.
Hello, everybody, and thank you for joining us on today's live version of Get in the Herd. My name is Raymond Ruybe. I'm your host and Director of Data and Quality Control here at McShinn. I'm joined today by two very exciting guests, and I'm going to introduce them very briefly, but then I'm going to give them the opportunity to talk about themselves and the organization that they serve. So first is Zico Singleton, and second is Mr. Colin King. So if you guys want to introduce yourselves and talk a little bit about Health Brigade.
Yeah, thanks for having us.
Hey, my name is Zico Singleton. I use she, her pronouns. I'm one of the coordinators for the Comprehensive Harm Reduction Program, or the Needle Exchange at Health Brigade. I've been in this role for about 2 years. I'm a woman in abstinence-based recovery. My clean date is November 26, 2018. I'm a Hep C and HIV test counselor, and I'm also a certified registered peer.
All right, cool. Colin?
And my name is Colin King. I'm a social worker by trade. I have been working in my role as co-coordinator actually since Zico started, but I've been with Health Brigade and the Needle Exchange program since 2019. And I'm also an HIV and Hep C test counselor, and also just recently got my phlebotomy training, which is something that is near and dear to our heart, and something that we're working on is transitioning people from knowing their status to giving them access to treatment, to Hep C treatment. So, I'm excited to be here and have a conversation. Thanks for having us.
Yeah, sure thing. Thanks for coming on. I'm really excited that you guys are here because I got to tour your facility a month ago. I'm really impressed with Health Brigade. You guys offer a whole host of services to folks in the community and those who are also seeking treatment. So I'll let you talk about Health Brigade a little bit in your own words.
Okay, I can go. I had no idea when I first started working at Health Brigade that there were so many different programs and services offered. Trans Health Clinic, Orion White Clinic, Charlie program, which serves folks who are incarcerated and re-entering society. It means a lot to me because my mom used to volunteer with Fan Free Clinic, which has since, changed their branding and name over to Health Brigade. So it's been one of the most incredible experiences of my life, especially being in recovery and being able to serve a population and people who I care so deeply about. Like, this is my life's work, and I know it.
All right.
Yeah, so just a little backstory about Health Brigade. I think the agency, I don't know the exact date that it started, but it was a clinic at first, mainly focusing on abortion access. In the 80s, they transitioned with the HIV epidemic to doing a lot of care and advocacy around HIV work. So when Virginia legislated that needle exchange programs could operate in the state of Virginia in 2018, Health Brigade so it was Fan Free Clinic, it's now called Health Brigade, same agency. They decided that was a kind of natural extension of HIV testing, community outreach work that they wanted to kind of do, and what better agency than an agency that is like Fan Free Clinic or Health Brigade that's been kind of community facing for a long time. And so our needle exchange opened in October of 2018, and I think before kind of me and Zico had more of a say of how our program went, it was a very much internal operation where people actually had to come to the building. But now we are much more outreach focused. We go out on a mobile van, and we really like to go where people are.
That's great. Yeah, I want to talk a little bit more about your outreach services because I know that you send a test counselor here to the McShin Foundation probably about once a month to do free Hep
Edward
C
Peters.
and free HIV testing here for our residents and participants. What other areas do you serve, and what do those services look like?
In terms of testing or just the services that our program provides?
Just all blanket. You talk about all of them.
Oh, gosh.
They want to hear all about it.
So, yeah, we do Hep C and HIV testing. We go where the need is. We have a few events coming up soon that we're going to hold at our outreach sites, our two busiest sites, which are in the Churchill section of Richmond and the South Side section of Richmond. We partner with Rams in Recovery at VCU a lot. We're going to have a testing event down there in June. We just show up where folks need us. We have established sites. We have an on-site site. Say that 3 times fast. We have that on Monday nights where we do outreach, and we have 3 sites out in the city, but we get asks a lot to show up in different spaces, like churches, different faith-based organizations, different mental health organizations, different housing developments. We show up where things aren't as accessible for the folks who need it. If they can't come to us, we'll definitely go to them. So, yeah, we show up.
That's great. That's quite the operation. I know a lot of people, maybe not too many of our viewers, but certainly in our unintended audience would say, like, what's the purpose of a needle exchange if recovery is the goal? And if folks need to realize that the only way for an addict to recover is for them to live.
Absolutely.
So do you want to talk maybe about some of the pushback that you might get out in the community and from the legislature on the work that Health Brigade does?
Oh, y'all are enabling. Y'all, like we're fostering these populations or these communities.
That's the pushback you're getting.
Yeah, that's the pushback.
Right.
It comes from the higher ups. It comes from the judicial system. It comes from people we know. What I do know is nothing like this was in existence when I was still in active use. I didn't see my first box of Narcan until I saw it with a non-Black person. These things weren't privy to those of us in inner city Richmond, right? I understand that these things are necessary because people are going to use regardless. Isn't harm reduction recovery? Anytime you lessen the risk of a behavior, and you use your seatbelt, you use a helmet when you're riding a motorcycle, you use sunscreen, that's harm reduction. Our goal isn't to be abstinence-based recovery. That's not our mission. But when people come up to us and say, hey, I need some help getting into treatment, we also assist with that. We'll flex our names and our positions. We can help people get into treatment that much faster.
That's right, yeah.
And I think just to add on to that, I think, as people that represent this program, as people that serve and represent a population that has been criminalized and stigmatized for so long, we take it serious when we are called to educate, yes, legislators and policymakers, but also when we're out in communities and there are people that live in those communities that maybe have certain ideas about what needle exchange is. We take those things really serious. We take our services out into people's neighborhoods where they live, and they should have a say in what goes on in their community. So we have a lot of conversations, sometimes hard conversations, with people in community. We try to bring stuff out for everyone, not just for injection drug use, but also, through the pandemic, making sure that we had hand sanitizer and mask. We bring food out in the community. That food is not just for participants in our program, but for people that walk by our van that live in those communities as well. So we try to kind of reach out, talk to people, educate them about why we think that harm reduction is important. And certainly when we're called into spaces like, the few chances we get to go to City Hall or meet with legislator or somebody comes to our building to learn more about that, or when we're talking to young doctors or whatever, to kind of educate them about why harm reduction is so important, why it's so important at, like you said, like keeping people alive, making sure that they have safe use supplies, and talk about how everyone deserves care, especially people that have been violently criminalized and stigmatized for so long.
That's right. Yeah, I'm a big fan of what you guys are doing out in the community and with the clinical services that you offer in-house. I was blown away seeing the kits that you offer out in the community. And I think that, just play devil's advocate for a second, only for a second. Some people think that, when you give an addict who's actively using syringes, that you're also kind of like the dope man. But you're not. You're just keeping them alive for when they seek recovery moving forward. Would you agree with that?
Absolutely. I had a police officer say to me, he said something along the lines of, there are some concerns that y'all are giving out these needles. And I was like, well, we're not giving out the dope.
You're right.
Folks are going to use regardless. I've seen too many people share using supplies before. I've seen friends of mine live with Hep C and HIV untreated, no linkage to care. We provide linkage to care. We provide legal support. We provide housing and all other types of support. We navigate these systems that have historically been designed to keep folks out.
Yeah.
So.
And I would say that those systems are really, if you want to have a real conversation about enabling, it is those systems that are in place that rob people of opportunities, that lock people up for long periods of time, that don't give them access to resources, that don't go into certain neighborhoods because they're black and brown or whatever. So those are really the enabling aspects of our society that actually promote those things that we're talking about. I think that our program offers something different. It offers a model of care instead of criminalization or stigmatization.
And punitive design, I couldn't be more proud of this program.
I couldn't either. And what you're really doing too is you're offering dignity
Absolutely.
to people who have been robbed of dignity.
Absolutely.
Because nobody in their active addiction is at their best.
No.
And they're certainly self-esteem is very low to begin with. You're coming in, you're saying, hey, you know what? You're not worthless. You're not useless. Here's something that can help you out. And then you're sort of like baby stepping them towards, and if you want additional help, come see us.
Sure.
Come get tested. Don't continue to spread a virus in the community. We think about recovery here at McShin as being similarly viral, right? The power of one addict helping another,
Is
that
without
peer-to-peer
parallel.
connection. That's right. But not to talk too much 12-step language, right?
But it's just it is basic. It's universal.
It is. But if I see Zico's doing really well and I'm sort of at rock bottom, you are inspiring me to do something more. Right?
Sure.
If Zico's then coming into my community and saying, here, we don't want you to get sick and die, like here are some supplies that could help keep you alive, well, I'm already building rapport with you.
Sure.
Then you could take me to the next level.
Sure.
And that's what we're really looking at, right? You're not enabling anybody to do anything other than to live and then hopefully seek treatment in the future.
We're a support. What we understand first and foremost is that recovery is not linear. Recovery looks absolutely different for every single person. Whether it's 12-step, whether it's not using so much of this and whatever. Recovery is recovery. We don't discount any form of recovery. For me, abstinence-based was the goal and is the goal every single day. That's not everybody's jam, and we respect that. So in the meantime, let's keep you safe. Let's give you a hug. We got a granola bar. And 9 times out of 10, when people reach out to us for other supports, we're successful in getting them to that place. We have participants of the program who identify as being in abstinence-based recovery or in MAT. They still show up to the community advisory board meetings that we have. They give us feedback. We're happy to write referral letters. This is ongoing. We're so much more than needles and Narcan. Like Colin always says, that can be kind of transactional. It becomes kind of rote and routine. But for the 3,000 people that we do have on the program, we have a really, really strong rapport with so many people, and it's evident in a lifestyle that doesn't offer you a lot of folks that you can trust. When I was in active use, I didn't trust anybody out here. I wouldn't have talked to anybody out here. We have folks we know when their kids' birthdays are, when their kids' graduations are. We understand when someone's going through something. I appreciate that so much. These people trust us, and we appreciate that. We're coming into your neighborhood. How many times have people seen gentrification happen where people just set up shop in whatever neighborhoods, and you just have to kind of take what's going on? We don't do that. We have real conversations with people.
And I think to add on to that too, I think our program has a real kind of opportunity to connect with folks that are the most ignored, that don't get the opportunity to have those conversations or those connections. So we do focus on people that are in active use, but that's not the only thing we do. We have lots of people that, like Zico said, graduated from the program, or for anybody out there listening, if drug use is in your past but you still need some support around what's going on in your life now, we're also there for those conversations and to support whoever would come to us for needs.
That's right. Yeah, and I would hope that if we have members of our audience who are looking to give back in one way or another, because another thing, the only way to keep what you have is to give it away
freely.
Please contact Health Brigade. We'll give you their contact information at the end of this podcast. All right, so I'm going to pick on you for a minute, Zico. So you work in harm reduction at Health Brigade, but you are in an abstinence-based program of recovery for yourself.
I am.
How do you navigate that? It seems a little complicated.
Aren't I the best person to be in that position? Don't I intimately understand what our participants are going through, what they might be thinking, in other ways that maybe Colin can't relate to, and that's not discounting or diminishing Colin's role and the way he shows up. It can be triggering some days, right? I think my family and friends had a lot of concern when I first started working there. Like I work in needle exchange. I was an IV drug user. I've worked on myself a lot. And like I said earlier, nothing like this was in existence when I was still actively using. I think that I've done enough work on myself, formally, spiritually, and all that jazz, to the point where I'm not triggered to use. I understand the need for this. Half of my adult life was spent in correctional facilities, in treatment programs. And I just got into a point where enough was enough. And I made a promise the week that I got high that I would reach back and help somebody else, right? And I'd live up to that promise every single day. I don't know if this works for everybody. A lot of people ask me for advice. Well, how'd you do it? I want to do that. And I don't have any advice on that. This works for me. I'm coming up on 5 years, and it's not to say that some days I do become a little bit overwhelmed with the day-to-day stuff. And this is where our roles have kind of morphed. I work more behind the scenes. I don't have to go out and do outreach as much as I used to. I know so many participants on our program, the same areas that we served in, I've really used in those areas. So I had to be really, really respectful of my recovery and recognize that this might not really be too safe for me, and it just works. And I'm really privileged to work with a partner and a colleague who understands that unique nuance that my recovery brings into the mix of my work. So I hope that answered the question. It's really multifaceted for me. I'm really guarded with my recovery. Nothing is worth me losing my clean time. It's just not. But I'm supposed to be in this role. I know that without a shadow of a doubt.
Yeah, what I heard you say there was, hey, what keeps me clean might not work for you.
Absolutely.
But what works for you isn't necessarily what jives with me. But let me help you in whatever way is more beneficial to you.
Absolutely.
All right. Yeah.
Absolutely.
Cool. Now, what about you, Colin? You're what we would call a muggle in the recovery community.
Mudblood. So Kind of my trajectory to get here was I was an intern at Health Brigade, a social work intern, and I was in the mental health department, and I volunteered my time with the needle exchange program because I thought it was really important. Didn't know a lot about harm reduction at the time. This was 2018. And when a position came open, they offered me the job. At the time, I was just an associate. At the time, there was nobody that was a peer in the program. And when I was offered the position to coordinate the program, I decided that I couldn't do it alone. So I said that I needed a partner, and I thought it was important that at the time that we find somebody that had some lived experience. And really, luckily, we found Zico. And I don't know why it works or how it works. But for me, personally, I can't think of a better person to work with. Zico's somebody that supports me every day. And for me, the reason that I'm in this work is because I feel like I can be a positive advocate voice for folks and people that have just been ignored, criminalized, stigmatized, and hopefully bring some more resources into this work, more and more resources. So
Sure, and I think as an ally too, you offer a voice to folks who aren't in recovery, who need to understand,
Yeah, that may be
why
true.
why this work is so necessary for everyone. How it benefits the person who's in their active addiction, but you're also benefiting the community too. If you
Absolutely.
decrease the spread of HIV and hepatitis C in the community, I mean, everybody's a winner in that situation.
Absolutely.
Yeah.
It's a win-win.
All right. Cool.
It's a win-win.
Hey, Steve, do we have any questions or comments from our audience?
Not yet. No.
All right. Well, yeah, we're doing great then.
Okay.
answering all the questions.
We're answering all the questions. Otherwise, they'd let us know.
Okay.
All right. Cool. All right. So as we begin to wind down, is there anything that you want to? Well, let me ask a question first before we get into winding down. Talk a little bit more about the in-house clinical services that you offer. Are those walk-in services?
No, you have to be a registered patient. I really don't speak too much to the way that registration works. But for us, for the needle exchange, our process is really simple. Can I touch on that?
Yeah, please do.
We never need to know a person's name. I don't
Okay.
need to know your address. I don't need to see your ID. I think that's a misconception a lot of people have when they come up to the van. We create a unique code based off of the letters of your name, your mom's name, and your date of birth. And we ask a few demographic questions, and that's where the inquiry ends. And we ask these because once you register onto the program, you're offered some protections in the state of Virginia. If we can prove, if you need us, if you were ever arrested for having your supplies on you, these are the legal supports that we can offer. Hey, this person is indeed a registered participant on our program. We've shown up for people in court. We've been subpoenaed to court. We constantly write letters of support. Being an active drug user should not be a punitive process. I will never believe that prison is the answer for someone who lives with a disease. I just won't. Like I said, I've spent half of my adult life in every women's prison in the state of Virginia. It's left me with some resentments and some animosities, but I still move forward. And I think it's important to note that we offer these supports. And once you're signed up with us, you're locked and loaded. You can get the Narcan that you need. Anybody can come and get Narcan. We don't say it's just for participants only, but once you sign up with us, you're a little bit safer. We offer you some safety. Yeah.
I didn't even know that Cloxon existed until I came to Health Brigade, and you gave me a box of it. And for those of you who don't know, Cloxano, yeah. Well, for those of you who don't know what it is, it's a double dose of Narcan in a single spray. So it's 8 milligrams of naloxone as opposed to the 4 that you get with Narcan.
Exactly.
And I was so impressed by that. I was like, wow, I'm just learning stuff new all the time. I'm sorry, Colin, what were you going to say?
I just wanted to plug some of the work we've been doing around Hep C because last year we spent a lot of time and focused a lot on hepatitis C testing. And we saw really, really high rates amongst our participants. I think it was over 50% of the people we tested positive for Hep C. So what we're working on and what we just created was a position who one of our associates, Jeanette Hall, also a peer herself, who's just an amazing, great person. Just wanted to plug her as well. But she just transitioned into a role as a health navigator. So what our focus is going to be is actually giving some people support around getting Hep C treatment. It could also be like substance use treatment or some other kind of goals that participants may have, but our main focus is going to be around hepatitis C. So that's something where we are not just testing people and letting them know their status, but we're also trying to give some supports around getting towards treatment. Because hepatitis C is one of those weird things that, could live in your body for a long time, may never affect you. Some people self-cure. It's a smaller rate, but really over time it can cause some it can cause cancer. It can cause cirrhosis of the liver. It can cause some really, really bad things. So what we're trying to do is make sure that people who in the past have not had access to that kind of treatment, that we're prioritizing that treatment. So just wanted to plug that as well, because that's something that we're trying to fold into our program as well, to give some more comprehensive services in and at the community. All right.
That's great. And you'd be giving those services on site, not just the testing, but also the counseling?
We're working on it. We're working on doing some phlebotomy out in the field. It's tough. It's tough, but we're trying to get there. But that navigation service, like signing up for that and talking to Jeanette Hall, who will be in this position, will be something that will happen in the community.
And the reason why that's so important is because people are usually handed off from this agency to this doctor's office to this one, and this is just one stop with Jeanette.
So we can test somebody at the beginning, do confirmatory testing either in the community or at our facility, and then transition to the medical clinic where we can provide treatment.
Full cascade of care.
Yeah,
cascading care. That's great. And that's all done at your headquarters location, right?
Yes.
You even have the clinical on site.
Yep.
So for some of our viewers who are in the Richmond area who would be interested in knowing how do I become a part of the Health Brigade, and I don't want Robert Key to hate me for doing this, but how do they then go through the registration service procedure?
So I will say that Health Brigade is first and foremost a free clinic, which means that we prioritize people that don't have insurance. Since the expansion of Medicaid, we've seen a lot more people at different income levels be able to have access to Medicaid, which is great. What that means is that a lot of our clinical services have been focused on uninsured or underinsured people, which has been largely undocumented folks. Mm-hmm. We do now accept Medicaid, but it's only a certain percentage. Even if somebody came and registered, if they're eligible for Medicaid, they're probably more likely to get clinical services at a place like Daily Planet, Crossover Clinic in Richmond. That doesn't mean that they don't have access to any of our services at Health Brigade. I just don't want to, tell people to come to Health Brigade only to be turned away. Mm-hmm. But if somebody were to get tested with us and they were transitioning to like hepatitis C treatment, if somebody needed trans health services, there are certain populations that Health Brigade prioritizes, even if they do have Medicaid.
All right.
It's just a smaller percentage of the people that we serve in the medical clinic.
Mm-hmm. All right. Cool. So how would they go about coming down and registering for services? Is that a walk-in process?
Yeah, it's a walk-in process.
All right.
They make it as easy as they can. There's several people on site who walk you through it. We have translation services available, and just come on down.
It's a process like any health clinic.
Sure.
Just to throw that out there too. There is a process. There might be a wait, that kind of thing. But what I do know is if we cannot serve them at Health Brigade, we will for sure.
There's a warm hand.
That's
warm
right.
handoff.
That's great.
We have good relationships with the other free
community
clinics
partners.
and low-income clinics.
All right, and that's why I love Health Brigade, everyone.
Yeah.
Me too.
All right. So as we then start wrapping up, any closing thoughts or ideas that you want to share with our audience?
Well, I want to thank y'all Thank you. Thank this podcast. Thanks, Steve, for having us. I always say that harm reduction right now seems really trendy and buzzworthy. We get a lot of people who like to spectate. It seems really radical. At the end of the day, what I want people to take away is that this is one of the most humane processes that happens right now. We always say we might be the kindest spot in somebody's day. Sometimes the participants just walk up, they don't even want supplies, they just come to say hi. I remember not being seen and not heard when I was in active use, and we worked really hard to dispel those feelings for our folks.
All right.
We're humane.
Yeah, I would just add, no shame if there's anybody listening that may need our services or in the future need our services. That's what we're there for. We're literally there for people that actively use and inject drugs. So that's what we're there for, and that's who we show up for.
All right, cool. And we have 2 big events coming up this summer. We have our Juneteenth celebration for recovery, and then we also have Pride Fest, which are going to happen here. So maybe I can, putting you guys on the spot, maybe you guys can bring the clinic over for that. That would be fantastic.
We'll check
At
it
least,
out.
all right, cool. Maybe even just for Hep C testing.
Absolutely.
All right.
We'll look into it.
All right. Well, thank you. I want to thank you both so much for coming in. As always, I love meeting with you both. And I want to thank our audience for tuning in to Get in the Herd. And I'll see you guys next week. Thank you.
Thank you so much.
Thank you.
Thank you.
Guys, you guys did a great job.
Oh my gosh, you're a good interviewer.